Minnesota Senate Health and Human Services Finance and Policy Committee. It is Wednesday, April 15th, 2026, and we do have a quorum present, although we won't be taking action on any items today. Our first item on the agenda is to discuss Senate File 4612, which is the Omnibus HHS budget bill. And the first item of business is to walk through the spreadsheet. And Mr. Bessel, if you wish to proceed.
Good morning, Madam Chair and members. Just to make sure we're all on the same page, the spreadsheet I have is dated yesterday, the 14th at 2:17 p.m., not a.m., so that was kind of nice.
Oh. Yes.
To orient you to the spreadsheet, in the center of it are the governor's proposals, and on the right-hand side are the Senate proposals. I'm going to focus mostly on the Senate proposals, although because of the way the Senate has divided up the governor's stuff between a program integrity bill and this bill, I will note when a proposal appears to not be included because it's in that other discussion. The top lines on the spreadsheet, lines 6 to 8, show what was in the forecast, the additional change in spending, and either for the governor and for the Senate, and then what would be the total general fund spending under each set of proposals. The rest of page 1 shows the total for all agencies on line 12, and then the subtotals for all the individual agencies on all of the lines after that, going over onto page 2. And then the first proposal the Senate does not pick up is the governor's transforming human services proposal. And then, so if we go to page 3 and begin on line 186, this is the governor's proposal relating to HR 1 and the MA eligibility changes that are required in there. And in this one, the governor proposed the changes to retroactive coverage for Medicaid, a requirement to obtain enrollee address information, the 6-month eligibility renewals for some Medicaid enrollees, work requirements for some Medicaid enrollees, and then restrictions on legal non-citizen Medicaid coverage. The Senate picks up most, but not all of that, in that the Senate is not picking up the change to retroactive eligibility. And that's the primary reason that there are differences between the amounts between the governor's proposal and the Senate's proposal. The next proposal is on line 207. This is also related to HR 1. And it's titled the financing related response. And the provisions the governor proposed in this bucket are a requirement that requires DHS and MMB to have a discussion if the provision in the provider tax is triggered that reduces it if the resources are greater than 25% greater than the needs, because there's some concern that because of the way HR 1 deals with provider taxes, that if it goes down, it might not be able to go back up. The second thing is the cost sharing requirements that the Senate does not pick up, not because the Senate believes that they don't need to be done or the state doesn't have to do them, but because the federal implementation date is delayed, and it would allow the next legislature to act on that proposal. There's also a proposal in this group that establishes a ceiling of $1 million for home equity values for individuals when determining eligibility for medical assistance for long-term care. And then there's funding for the department to work on, I should say, to begin working on program oversight and support to deal with this somewhat technical sounding change in the federal bill in HR 1 that has the potential to subject the state to a reduction in federal funding if the state ends up exceeding a 3% error rate in a variety of ways dealing with the MA program. And that also has a delayed effective date, but I think the intent of the proposal is to begin doing the work now so that when it does become effective, the state is not in a position to being sanctioned under exceeding that 3% threshold. The next proposal is on line 216 at the very bottom of page 3. And that proposal is going to be in the Senate's program integrity discussion. The same is true on page 4. On line 240, the governor's variety of proposals dealing with program integrity. On page 5, another program integrity proposal is the uniform service standards. Line 275 on that page, the Senate is picking up the governor's proposal to increase fines and establish new fines to promote licensor safety. The Senate is not picking up, at least in this bill, the next two governor's proposals. On line 300 on page 6, the Senate picks up the governor's federal compliance proposal relating to background studies for household members. These next, looks like 5 proposals are mostly technical, and they relate to things in the budget that affect money but don't have money attached to them, which is why you see the hash marks instead of dollar signs. Hash mark indicates that it is in the bill, and you can see the Senate has picked up all of them. The first one on line 304 is a technical change relating to rural emergency hospitals payment methodology. The next one on line 306 is updates to the hospital-directed payment program. Line 308 is a proposal about targeted case management and the way the payment methodology is developed and certified public expenditures. There are all a lot of complicating ways of addressing that. Line 310 is a proposal to sunset a supplemental payment for Hennepin County Medical Health Clinic. And line 312 is a proposal to modify the definition of residency for non-Title IV foster children in determining eligibility for MA. It deals with kind of a unusual circumstance where a child comes to Minnesota who was eligible for Medicaid in another state and has difficulty accessing care unless they can be eligible under Minnesota's Medicaid program. The next proposal is on line 314. This is a series of budget technical changes that correct, I would say, coding errors that were in last year's bill, where money ended up being appropriated to the wrong area in the agency. And so all of these transactions just move the money around, and the only reason it shows a cost is because that, I believe, is money that is moving between agencies. In this case, between DHS and MDH. Line 330 at the bottom of that page is the DHS portion of the governor's IT systems proposal that is primarily in the Department of Children, Youth, and Families, but does have associated costs in DHS. On the next page, on page 7, on line 335, is some more technical adjustments, and this is a proposal that is dealing with some remaining reconciliation of money that needed to or should have transferred to DCYF when it was established. That's the end of the governor's proposals. Line 342 is Senate File 4933. This is Senator Wiklund's bill dealing with mental health provider rates in medical assistance. On line 351 is Senate File 31, part of Senate File 3299, Senator Mann's bill that deals with the managed care pharmacy dispensing fee. On line 359 is another provision from that same bill dealing with the pharmacy dispensing fee, the DPP for the pharmacy dispensing fee, and the fact that it has not been approved yet. This is an attempt to have an interim state-funded adjustment. On line 367 is Senate File 1961. This is Senator May Quaid's bill that has a requirement, a coverage requirement for infertility treatment. That proposal is $1.8 million in 26 and 27, and $8.6 million in 28 and 29. And on line 375 is a technical accounting adjustment that transfers what would otherwise be the Healthcare Access Fund portion of spending in this bill to the general fund, given that the Healthcare Access Fund under the forecast has a projected deficit at the end of fiscal year 2029, and the desire of the Senate is not to make that problem worse. That's the end of the Department of Human Services. At the top of the next page, page 8, is DCYF. The first item on there is a governor's proposal that largely aligns with Senator Bolden's Senate File 4359. Senator Bolden's bill is different. It mostly picked up just the cost for the food benefits, but in the Senate's position, the Senate's also picking up the governor's other activities under that proposal. The next line on 404 is the Child Care Assistance Program Integrity Package. Obviously, given its name, it is in the Senate's Program Integrity discussion. On line 421 is a series of DCYF technical funding adjustments that we talked about mostly in the DHS conversation, although this one includes a transaction with the Department of Education, and you'll see the other side of that transaction in a little bit. On line 428 is the governor's IT proposal. The Senate does not pick up the governor's proposal, but has one that will be considered along with it. Only the Senate's money goes to Minute, and you will see that coming up a little later. The next proposal on line 435, the Senate didn't, has in its program integrity discussion. Now is the end of the governor's DCYF proposals. On line 441 is Senate File 4335, Senator Champion's additional funding for MAFPA of $15 million per year ongoing. Line 448 is Senate File 4324, Senator Wiklund's child care licensing modernization, and that is $2.9 million in the first biennium and 2.1 in the second. Senate File 4359 on line 456 is Senator Bolden's proposal to have the state pick up the additional county administrative costs that were in HR 1, and that is $24.3 million in 26 and 27, and $64.8 million in the tails. Line 460 is Senate File 3904. This is Senator Mann's additional funding for food shelf grants of $2.7 million. Line 464 is Senate File 1412, Senator Kupek's additional funding for the prepared meals food relief grants of $2.5 million. Line 468 is Senate File 3770, Senator Bolden's additional funding for regional food bank grants of $5 million. And that is the end of DCYF. Next is the Department of Health. I'm on page 10 now. On line 509 is another one of those technical changes. This one relates to funding moving between DHS and MDH. The next one is the money for a proposal to transfer regulatory oversight of HMO health plans from MDH to Commerce, and you'll see the Commerce side of this transaction in a little bit. Line 517 is the governor's proposal to establish a fee schedule for the all payer claims database, and you'll see on the lines below that it is revenue coming in from the fee and an appropriation to spend the fee to respond to the requests. Line 522 is an appropriation from the state government special revenue fund for HMO regulatory activities. The fees were increased last year for this purpose, but somehow the appropriation of those fees got dropped. Line 526 is missing part of its description. This is a proposal to extend the availability of appropriations for the Health Professionals Education Loan Forgiveness Program, and that's included. Line 528 is a proposal to add, to bring the fee exemption requirements for newborn screening into statute. Line 530 are a series of modifications to rural clinical training grant programs. All are intended to have the money available longer or make it available to more individuals. Line 532 currently does not have a bill number. This is Senator Wiklund's proposal to provide a grant to Hennepin Healthcare for HCMC of $150 million one time in fiscal year, in the first biennium. Line 537 is Senate File 5047. This is Senator Wiklund's bill that provides provider stabilization grants to hospitals and safety net providers, and you can see the amounts for each one of those groups on lines 539 and 540. The total is $133.6 million in the first biennium and $800,000 in the second. I'm on page 11 now, on line 544. This is Senate File 4771, Senator Hemmingson Yeager's bill to provide a grant to Helping Paws of $200,000. On line 48 is Senator Hoffman's Senate File 2638, dealing with submerged closed-loop heat exchanger variances. This bill is still in discussions. It's on here because there is an expectation that once those discussions are resolved, there could be a need for funding. The next section deals with other agencies. The first one is on line 654. This is the Office of Emergency Medical Services. They are one of the providers in the uncompensated care coalition, provider groups, I should say, in that coalition. And this is for additional funding for the Rural EMS Uncompensated Care Pool Program of $15 million one time. The next line is 660, and this is the Senate's position that is in the same policy area as the governor's IT proposal for DCYF. Of $45 million in the first biennium and $25 million in the second. The Senate's position funds a variety of county IT priorities and also has a steering committee to help guide decisions about those priorities. The next proposal on line 664 is also from Senator Wiklund, Senate File 4719, and establishes a legislative commission on human services to talk about the future arrangements of delivering human services programs. For the LCC, that has a cost of $194,000 in the first year, and then in the second biennium, $365,000. On line 668 is an amount to the Department of Public Safety. This is from Senator Wiklund's Child Care Licensing Modernization Bill, Senate File 4324, and that has $549,000 of cost in the first year, and then $544,000 ongoing. The next proposal is on line 679. This is a proposal of the governor's that allows MNsure to reallocate an existing appropriation and to use it for IT and operations, and the Senate picks that up. On line 686 is the other side of the transaction, moving money from MDH to Commerce for regulatory oversight of HMO health plans. On line 691 are two proposals for the Department of Management and Budget. On line 693 is the Governor's Healthcare Safety Net Stability Study, and that's one-time funding of $250,000. And then on line 694 is the Senate's Hospital Stability Report that is part of Senator Wiklund's Hospital Stabilization Grant Program, and that's $200,000 a year ongoing. And then the final one is the Department of Education on line 696, and this is related to those technical adjustments between DCYF and, in this case, the Department of Education. Madam Chair, that is it.
Thank you very much. Members, do you have questions for Mr. Vessel about the spreadsheet? Senator Abler.
Well, thanks, and maybe for you, just a question about the process. I understand there's no targets, and so I guess I could just take this as what the chair would wish could be if there were money. Is that a fair way to describe this?
Well, it is that, but it is also been socialized with the leadership and caucus priorities, weighed against caucus priorities, and so it is informed by that as well.
No, I get it.
I mean, I just want to say it's not that we just proposed this and are just putting it out there. There was discussion that led up to the proposals and the amounts, so.
Well, thanks, Madam Chair. And I understand your caucus priorities and all that. And so, just if I understand, Mr. So the cost of these priorities is about $750 million over the 4 years. Is that right, Dennis? Is that right?
Mr. Vessel?
Well, I didn't add up those numbers, but doing so now, yes,
Line
about.
12. Yeah, all right.
Senator Abler?
No, it's, thank you.
Any other questions?
And Madam Chair, I have some questions to the bill, but this is to the spreadsheet.
Yeah,
Thank
I
you.
just meant for
Much obliged.
the fiscal analyst. Okay. Well, thank you.
You're welcome.
Now we will move to a walkthrough of the bill index, and Senate Council will provide that, and I'm not sure who wants to start. Ms. Heiko?
Thank you, Madam Chair. Senate Council will now provide a section-by-section walkthrough of the bill using the bill index, which is included in your packets. Beginning with Article 1, covering the Department of Health. All of the sections in this article, except Section 17, are from Senate File 5048, the Governor's Budget Bill from the Minnesota Department of Health. Sections 1 and 2 create a fee schedule for the Commissioner of Health to assess fees on individuals and organizations receiving data under the All Payer Claims Database. Section 3 provides criteria in which a newborn screening fee exemption may apply and provides what is needed to qualify for the exemption. Section 4 strikes language that requires funds remaining for the Health Professional Education Loan Forgiveness Program to cancel at the end of each biennium. Section 5 strikes language that requires funds remaining for the Home and Community-Based Services Employee Scholarship Grant and Loan Forgiveness Program to cancel at the end of each biennium. Sections 6 through 8 modify requirements for the health professionals' clinical training expansion and rural and underserved clinical rotations grant program, including specifically that programs eligible for grants include an accredited program or a candidate for accreditation, and adding application requirements for the grant programs. Sections 9 through 12 modify requirements for the primary care rural residency training grant program, including adding that a program that trains postdoctoral psychology residents is eligible for grant funds. Sections 13 through 15 modify requirements for the International Medical Graduates Assistance Program related to the availability of program funds awarded to grantees. Section 16 modifies the purposes for which a tribal government may use local public health grants. And Section 17 is from Senate File 2638, authored by Senator Hoffman. And this establishes conditions when the Department of Health must consider a variance for an undue burden related to the isolation distance requirements for a water supply well used in a submerged closed-loop heat exchanger system. Thank you.
Thank you, Madam.
Mr. Hidalgo?
Thank you, Madam Chair. Committee members, I will pick up at Article 2. Article 2 on the Department of Human Services is entirely comprised of sections from the governor's budget bill for the Department of Human Services, that bill being Senate File 5019. Section 1 provides that applicants, license holders, certification holders, and controlling individuals under Chapter 245A must not engage in conduct that threatens the safety or well-being of DHS staff, county employees, or other individuals. Section 2 increases fines for license holders under Chapter 245A for health, safety, supervision, or background study violations and for other licensing violations. Section 3 of Article 2 prohibits a commissioner from imposing an assessment under the hospital assessment, which was enacted in the HHS Omnibus last session, if that hospital does not receive payments under the Hospital Directed Payment Program, which was also enacted in the Omnibus last session. Section 4 modifies the payment structure for certain disproportionate share hospitals to increase the amount calculated for the MA disproportionate population adjustment before the hospital's alternative inpatient payment rate is calculated. Section 5 modifies the definition for residency for non-Title IV-E foster children. Section 6 of the article permits a hospital participating in the directed payment program under Section 256B.1973, that's HCMC's existing directed payment program, to elect to participate in the program under Section 256B.1974, that's last session's hospital directed payment program, upon substantial changes to federal law related to hospital directed payment programs. Section 7 requires DHS to reimburse critical access hospitals that convert to rural emergency hospitals under the department's current cost-based outpatient rate methodology paid to critical access hospitals. As you'll note in the index, this was modified. However, it was purely technical. The section consists of the addition of a single new paragraph. That paragraph was simply moved to the end of the subdivision to avoid having several internal paragraph cross-reference changes. And then the final section of this article was a repealer. It repeals a supplemental payment to the Hennepin County Mental Health Clinic that is now obsolete due to the clinic's transition from a fee-for-service mental health clinic to a certified community behavioral health clinic. As with Article 2, the third article, titled Human Services Federal Compliance, exclusively includes proposals from Senate File 5019. Sections 1 to 2, 5, and 14 to 24 of that article establish a new cost-based rate methodology and reconciliation process for targeted case management services provided by counties. Sections 3 and 4 remove the requirement to conduct FBI criminal history checks for household members connected to adult day services and adult foster care. Section 6 of the article requires the Commissioner of Human Services to establish a healthcare eligibility oversight unit to collaborate at a regional level to ensure that MA eligibility requirements are consistently applied. Section 7 requires the Commissioner of Human Services to obtain and use information from reliable data sources. Those data sources are specified in the law to update contact information for medical assistants and Minnesota Care enrollees. Examples of those reliable sources include managed care plans, other human services programs, return mail with a forwarding address, as well as USPS's National Change of Address database. Section 8 establishes a limit of $1 million for the allowable home equity to receive medical assistance payments of long-term care services. That begins in 2028. Sections 9 to 11 make substantive and conforming changes to comply with recent federal law changes. Those changes require 6-month eligibility redeterminations for the expansion group. Those individuals are those eligible for MA under section 256B.055 subdivision 15. Section 12 of the article makes substantive and conforming changes to comply with recent federal law changes that condition medical assistance eligibility for the expansion group on the completion of work and community engagement requirements, subject to certain exceptions. Section 13 provides that MA is only available to non-citizens who are eligible for coverage with federal financial participation through either MA or CHIP. Section 25 provides that individuals denied or disenrolled from medical assistance for failing to comply with the new work and community engagement requirements are ineligible for Minnesota Care. And the final section 26 requires the Commissioner of Management and Budget to consult with the Commissioner of Human Services to determine if the actual cash balance in the Healthcare Access Fund is adequate for purposes of a potential reduction of provider tax rates pursuant to section 295.52 subdivision 8. Moving on to Article 4. Article 4 contains 2 member bills, specifically Senate File 3299, authored by Senator Mann, as well as Senate File 4933 by Senator Wiklund. Both of these bills provide bridge reimbursement rate increases for providers for a temporary period of time until these bridge rates would expire upon either federal approval of a previously enacted law or an enacted program becoming implemented. The first section of Article 4 comes from Senate File 3299, previously mentioned as authored by Senator Mann. This requires the Commissioner of Human Services to pay eligible retail pharmacies exclusively with state funds an additional $2.25 as a dispensing payment per prescription filled under the medical assistance program. Section 2 is from that same member bill. It requires the Commissioner of Human Services to ensure specified final pharmacy reimbursements in the prepaid medical assistance program according to a methodology that was established for the single pharmacy benefit manager proposal that was enacted in 2025. Section 3 of the article comes from Senate File 4933, authored by Senator Wiklund. It requires medical assistance reimbursement rates equal to 100% of the published Medicare rates for neuropsychological assessments, neuropsychological testing, as well as psychological testing. You'll note that this was modified. Specifically, the language of Senate File 4933 was modified solely by the addition of a single sentence. This was related to Section 3 of this A2 amendment. That sentence was technical assistance suggested by DHS, and it clarifies that the reimbursement rate is 100% of the Medicare rate, notwithstanding any other rate increases or reductions in law for those specified mental health services. And finally, for Article 4, Section 4 is a repealer. This repeals a subdivision requiring medical assistance to reimburse master's prepared mental health professionals at 80% of the rate that is paid to doctoral prepared professionals.
Thank you. Ms. Hoffman-Litchie.
Thank you, Madam Chair. Madam Chair, committee members, Article 5 contains proposals within the jurisdiction of the Department of Children, Youth, and Families. Sections 1 and 4 are from the Department of Children, Youth, and Families budget bill. They require the Commissioner of Children, Youth, and Families to pay the state share of SNAP benefit costs and to bear the amount of certain disallowances or sanctions. Section 2 is also from the governor's budget bill. This removes the preschool assessment from being part of the kindergarten entry assessment under the Commissioner of Education and instead requires the Commissioner of Children, Youth, and Families to implement it as part of the recodification efforts of creating the new department. Section 3 is from Senate File 4545, authored by Senator Bolden. This allows paid break time to count as qualifying hours towards the child care program's reporting of eligible full-time equivalent staff for the purposes of the Great Start Compensation Support Payments Grant Program. Sections 5 and 6 relate to Sections 1 and 4. This is from Senate File 4359, authored by Senator Bolden. They prohibit a county agency from contributing more than 50% of the total SNAP administrative costs, and also makes a cross-reference update. Section 7 is from Senate File 1412, authored by Senator Kupek, and establishes a prepared meals food relief grant program. And finally, Section 8 is from Senate File 3770, authored by Senator Bolden, and this establishes a regional food bank grant program. Articles 6 and 7 are part of the Child Care Licensing Modernization Project. Article 6 contains the Child Care Center Licensing Modernization Updates. They update and codify licensing requirements for child care centers, and then Article 7 does the same but for child care providers. All of those provisions are from Senate File 4324 as authored by Senator Wiklund. Article 8 are changes to the Minnesota African American Family Preservation and Child Welfare Disproportionality Act. They are from Senate File 4335, authored by Senator Champion. They modify the definition of disproportionately represented child. They determine the process by which the Commissioner of Children, Youth, and Families must make a determination of disproportionate representation. And they require the Commissioner to conduct a case review of 10% of certain child protection cases, repeals the definition of disproportionality, and also makes conforming changes. And finally, Article 9 is miscellaneous. Section 1 is from Senate File 3705, authored by Senator Mann. It reimposes a previous requirement that health plan companies must credential and contract with mental health providers that meet specified conditions. And then finally, Sections 2 through 5 are from Senate File 4719, authored by Senator Wiklund, and they establish the Human Services Systems Steering Committee and the Legislative Commission on Human Services Systems. Thank you.
Thank you. Members, do you have any questions about from the standpoint of a technical question about the language or the index? Otherwise, I'd like to move to our testifiers, but do you have a question? Senator Abler? Oh. Senator Abler?
Well, Madam Chair, I think just even before we just saw this, and so I think there's some, if I could just ask a few questions, or at least that would be, I think, helpful for us as members here.
Well, I wasn't intending to not have any chance for members to ask questions.
Yeah.
I just wanted to see if there were questions about what was just reviewed in the summary
Well, Madam
form.
Chair, how many testifiers are there?
Well, there are about a dozen, so.
Okay, well, let me
I do want to get
raise
through
my
those.
points, and then we can make sure that I have questions about this all claims data stuff, if that's going to be, if that's an expansion, if that should have gone to judiciary. I have a question about the current status of immunization records, the current status of a well test, about this preschool assessment, how's that compared to what's done in the schools now? I have a question about the firearms. What's the current law about that? Just for starters, and so whenever we can get to that, I'm just disappointed that we have this huge letter from Ms. Cunningham still about the child care stuff. I spent some good time with the department staff, and they've come a long ways, but I'm concerned that with the way your bill is, it's problematic with some of these items that are in there, and we had talked about that before, and so anyway, I'll leave it at that for now, and I can be more specific later. So thank you.
And did you, Senator Atke, have a question?
I'll just throw out one thing that's come up that we see and might flush out as we go forward with testifiers and the follow-up to it, and that is with the IVF showing up in the spreadsheet, but there is no language in the bill, and there's no fiscal note that seems to be out there yet, but we do have numbers in the spreadsheet. Probably a little more information as we go forward here today as to what the plan is, what people should expect and such. So Thank you.
Thank you, Senator Atke. That one, it is a bill that we passed out and is sitting in finance, and so I was hoping that by the time we get the bill through to finance, we would have more information, and the fiscal note information would be more solidified. So that's why we didn't include the language, because we had already passed it out of our committee and it's in the finance committee. Does that make sense? And Senator Abler, just so you know, some of the things you mentioned are, well, I will just say for everybody else, some of the items in here are from governor's budget proposals relating to specific agencies. And so if you have questions about an item that is one of those are things that we did here in committee and had a chance to discuss. But, you know, if you want to raise them up for additional questions, I just wanted to let you know some of those items came from the governor's proposals. So now I'd like to go to testifiers and go through that, and then we can return to member questions. First, we'd like to go to Zoom testifiers, and I would appreciate, since we do have a number of testifiers, that testifiers please keep your testimony concise. And I will go first to Cindy Cunningham. If you can please state your name for the record.
Yes, Senator Wiklund, can you hear me?
Yes, we can hear you.
It's always that question with technology, right? I am not going to go on camera so that I can concentrate on reading. I appreciate the shout out, Senator Abler. My name is Cindy Cunningham. I'm a licensed family child care provider for 30 years of experience in Ramsey County. I serve as a certified trainer, course writer, and the public policy chair for Lead and Care, the 501c3 association representing licensed family child care providers. Many have heard me since November state that we wanted a collaborative bill which didn't need so many amendments. We don't have that. It's going to take amendments and more work at these tables. Article 7 as written is not supported by Lead and Care. This is our livelihood. This is our industry. Parents need us. Please refer to the detailed testimony in your packets for some of the specifics we are continuing to ask for. I will keep my comments here as brief as possible. The items we are opposed to came after public engagement last June and at the direction of the new department and new staff after July. Some of the staff have never had experience or relationship with Minnesota family child care, and this shows. The department seems to have a negative bias and lack of understanding of our industry. We have realized that with the delegated license, our county licensors know us through the good and the bad. The state agency only knows us through the bad, correction orders and licensing actions. At the same time in this process, the agency has seemingly been given veto power to our voices. Centers are getting less regulations, we are getting significantly more regulations. Unfortunately, very little public discussion on this project when it impacts us so significantly has been taken. Specific details not reflected in the bill, which providers have attempted to have our voices heard through amendments and interactions. The agency does not agree with these points, so therefore they are not reflected of those actually providing care and running these small businesses. I've listed a few in the testimony and will highlight a few here. The ratios, line 149.8, removes the B1 infant toddler ratio. It's cited by the agency that there aren't very many B1s. The agency doesn't seem to understand that people with the B2 ratio utilize that other ratio. Separation of children, line 162.14, is restraints that we are not to separate children. Children may need to be separated for a short time for everyone's best interest. Current wording does not allow that. We take training annually on abusive head trauma, which instructs caregivers to find a secure place for a child when interactions become stressful or difficult. The restriction proposed in this bill contradicts our actual training. Firearms, beginning with line 146 and then again at 181, we share the concern about children's safeties around firearm. The presented wording requires a public statement of the presence and then again the addition of firearms onto the property. Through our policies and sharing of our policies, we maintain no privacy and therefore no safety. We have proposed an amendment which only changes how we communicate with families, does not lessen the concerns. Again, the agency does not agree with this, and so it is not in this bill. Supervision of a provider's own children, line 150.42. Families frequently enter this industry with their own young children. Then they find that their rights to parent their children in their own home are severely restricted. In 2024, the agency made a modification to the oversight of this dynamic based on ALG legal rulings and recognized that these private parental rights needed supported. The agency implemented practices and clearly included the wording in draft 2. They have refused to share this wording with providers and have taken into consideration as the wording to cover us. This bill does not reflect the detailed wording that providers and licensors need to be able to implement and ensure that we're all following the rules as intended and keeping children safe. Excuse me. The main original goal of this project was to assure that Rule 9502 into statute. Then in future sessions, we can continue openly to do what we have for years. If this bill doesn't pass, we revert to current law and structure with 9502 locked in rule only to be reopened by the agency. They haven't done for 30 years, which is why we have all invested this project. Should the bill be enacted in its current form, it will create challenges for our industry. The sector has already experienced significant reductions which have left families with fewer options for child care. We have discussed with members of the agency. We have been heard, but we have not been listened to. Leading Care would oppose Article 7. The bill is written without amendments presented by providers and associations. We would rather have this portion not pass and work on it in the future than have it passed in its current form. Thank you for your time and efforts, and appreciate your presence.
Thank you. Next, we'll go to Brandy Sroga-Coons, and I apologize if I'm mispronouncing your name.
Nope, you did good. Good morning, Chair Wiklund and committee. My name is Brandy Soroga-Coons, and I am the Executive Director of Creative Kids Academy, which has 13 metro locations. First off, I want to be clear, I'm testifying in support of moving forward the center-based licensing standards. I have worked in the childcare field for nearly 28 years, yet we are still operating under licensing rules that date back to the 1980s. To think that today many of the educators were not even born then. It is clear that these outdated regulations no longer reflect current best practices or the realities of modern early childhood education. For example, licensing requirements still reference outdated equipment such as a cassette or record players rather than aligning with today's technology and learning environments. More importantly, some regulations conflict with current health and safety guidance. We are required to have 2 blankets per infant, despite the back to sleep recommendations that advise against the use of blankets for children under 12 months. Situations like this highlight the urgent need to modernize licensing standards so they are consistent with current research and safety recommendations. For these reasons, the licensing modernization draft must be passed now rather than delayed further. Although this draft is not perfect and needs a lot of work, it is better than the outdated rule we currently use. Even if passed, implementation is not expected until July 2027, meaning children and providers will continue operating under these outdated rules for many more months to come. Passing the draft would also allow for the implementation of the weighted risk system, which more accurately reflects the severity of licensing violations. Current minor issues, such as a child not flushing a toilet, is treated the same as serious hazards like bleach being accessible to children. A weighted system would provide clearer information to families and insurance providers about the true level of risk. Additionally, childcare providers are facing increasing challenges with insurance companies raising premiums or dropping coverage altogether. Updating licensing standards and implementing a risk-based system could help provide much-needed relief and clarity within the industry. Modernizing childcare licensing is not just necessary, it is overdue. I also like to mention, I was just informed that another bill that I'm a part of for the Great Start compensation is being heard today as well. I just wanted to speak in support of the Great Start compensation, that the new paid break law is causing issues with losing funding by having to deduct those hours from the Great Start compensation grants. So I am in support of using, including the break times in with the Great Start compensation payments so that we, providers do not see a reduction in the funds that we're currently receiving. I appreciate it and thank you for your time.
Thank you. Next, we'll go to Dawn Uribe. If you can please state your name for the record and begin.
Yeah. My name is Dawn Uribe, and I'm the owner of Mis Amigos Preschool. Before I get started, I wanted to quickly say that I understand that why family child care providers are concerned, and some of those same types of concerns that they have are fixed for centers. So I'm speaking in support of center, the regulation modernization. Madam Chair and members of the committee, thank you for this opportunity to speak. And this current bill is not perfect. Nothing ever is. But the revised center standards give providers more flexibility, clear guidance, and a system that actually weighs how serious a problem is instead of treating everything the same. I want to share a story about why finishing this work this session really matters to me and my business. Recently, one of my programs got a couple of citations. The public record says hazardous objects were accessible to children. That sounds scary, but in this case, it was a play rug with a small bit of printed design that was peeling up. On a separate occasion, I was also cited for a package of diaper wipes that were left on a counter with that same title. Another one said children were subjected to prohibited disciplinary actions. That sounds super scary. In reality, it was a couple of babies buckled into their high chairs for a couple extra minutes while they waited for a diaper change, but they didn't have a toy on their tray. These weren't perfect moments, and we retrained everyone on why it's important to meet those standards, but they're not the same as real safety failures, and our current system treats them like they are. That information is public, permanent, and has no explanation attached to it. This affects my school in real ways. One, I don't know the number of parents who have seen that information and never called us. And my insurance goes up. In 2024, our insurance increased by 50%. A program doing great work and a program that genuinely isn't look exactly the same to a parent or an insurance carrier. Families deserve to know the difference. Providers who are doing right by kids should spend less time on licensing. Licensors should be able to spend more time on programs that are clearly not meeting the standards that matter most. If nothing passes this session, we're realistically looking at July 2028 before anything changes, and that's 2 more years of hurting good providers while not focusing on the providers who need the most attention. Please help us get this done this session. And as Brandy mentioned, I also want to show my support for including the new paid break laws into the Great Start compensation grants. For me, it's not even just the financial part of missing the new paid break law. It's really about the time that it takes for us to calculate that. We're including that time in our payroll systems, but we have no other real way of tracking and subtracting that information. So it is just a real administrative burden of figuring out what that real number is. Thank you so much.
Thank you. And last on Zoom, go to Amy Worsbach. If you could please state your name for the record and begin your testimony.
Yeah, Amy Warzabach. Good morning, Chair Wiklund and committee. I'm Amy Warzabach. I'm the preschool director of Dodge Nature Center and Preschool, a licensed child care center in West St. Paul since 2000, and a member of the Minnesota Early Childhood Outdoors, representing nature-based preschools throughout the state. I'm here today because I care deeply about children's access to learning outdoors and the impact the proposed regulations could have on this. Nature-based providers are concerned that the language in this bill would actively discourage childcare programs of all types from providing children with experiences in nature and with natural elements. We do understand this bill may pass. If it does, we feel strongly that the 6 amendments in our nature-based childcare program written testimony should be adopted. They're narrowly targeted, cost-neutral, and consistent with the Modernizations Project's own goals. One amendment we propose is improving clarity of language around animal vaccination requirements. Research and historical care practices promote connecting children to animals to support development of empathy, caring skills, and many more things. In center-based programs, there's a call for animal vaccinations, which is very reasonable for certain types of animals like dogs and cats who have vaccine schedules and guidance readily available at your local veterinary clinics. However, it's unclear what to do for many other typical house pets and animals that don't have those recommendations. Our program in particular has promoted connection with animals for over 25 years, including turtles, hermit crabs, fish, chickens, and more. And these connections have greatly benefited children's development and inspired rich curriculum every year. Regulations should be specific about which animals require vaccines, or if this varies by geographic location, what guidance programs should use to make vaccine decisions. I appreciate your consideration of this and the other 6 amendments highlighted in the testimony to ensure children will have access to nature and natural materials in their care settings into the future, should the bill move forward. Thank you. And I also support including the paid breaks in the Great Start Compensation Grant Program, like the other center providers have shared.
Thank you very much. Now we'll go to in-person testimony. And first I'll call up Claire Sanford. And I'll also call forward Stephanie Lewis, if you could come to the table as well. And Ms. Sanford, if you could state your name for the record and begin.
Thank you, Madam Chair and members. My name is Claire Sanford, and I am on the board of the statewide Minnesota Child Care Association, which represents licensed child care centers. And I'd first just like to start by thanking the chair for including the Child Care Center Regulation Modernization Project in this bill, and also for the inclusion of Senator Bolden's bill around the compensation payment program. The compensation payment program, as you've heard, is something that we feel will reduce administrative burden on providers with this interaction between the new employment law around paid breaks and the compensation support program. We're just trying to maintain the status quo, and we're not trying to get more funding or change the funding. We just don't want the additional administrative burden on providers or for any of that funding to go down. And in terms of the regulation modernization process, as you've heard, our standards and our system is from the 1980s. The regulation modernization project itself has already dragged on for 5 years, and there is real urgency to get it over the finish line this session, both the updated licensing standards and implementing the risk-based assessment system. And I'd like to share a few words from insurance professional Amy Jo Van Keulen of the Marsh McLennan Agency. She testified yesterday to this in the House, but was unable to join us today. So Ms. Van Keulen writes, despite its importance, our licensing system has not been updated since the 1980s. And again, she's writing this as an insurance professional. These nuances impact the insurance market, often resulting in child care providers being categorized as high risk and facing excessively expensive premiums or denial of coverage altogether. An issue that poses no real safety risk can be misinterpreted by underwriters as a serious violation. I have personally encountered providers in tears pleading for help to find affordable insurance, many of whom have never filed an insurance claim but are penalized due to licensing report reviews. Clearer, more precise language and signaling which violations are truly concerning will enable insurers to better assess risk, leading to more affordable and accessible coverage options directly impacting affordability and availability of childcare. Thank you.
Thank you very much. And now I'd also like to call forward Andrew Knox. And Ms. Lewis, if you could state your name for the record and begin.
Yes. Chair Wiklund, Vice Chair Mann, and members of the committee. My name is Stephanie L. Lewis, Associate Vice President, Advocacy and Community Impact at Greater Twin Cities United Way. I was before you last week speaking about our 211 resource helpline. Today, I want to center the frontline workers behind the helpline, the people who answer the phone when a family is facing eviction, when a parent is worried about keeping their lights on, or when a senior runs out of food and doesn't know where to turn. Over the last decade, Minnesota has navigated some challenging moments. In the midst of uncertainty, 211 has been on the front lines supporting communities in their hour of need. During the flash floods in southern Minnesota, when roads were washed out and surrounding homes and businesses were inundated with water, Minnesotans turned to 211 seeking emergency shelter, access to food resources, and guidance at a moment when trusted information and human connection mattered most. 211 also helped residents navigate the aftermath of the wildfires in northeastern Minnesota, keeping them safe and connected when options felt limited. We don't know what the future holds, but we do know this. When the next crisis comes, 211 will be there, answering calls, supporting people before situations escalate, and helping Minnesotans navigate complex systems. We recognize that this committee faces many difficult choices and competing priorities this session. As budget discussions move forward, we hope there is room to consider the role of 211 in the final package. Investing in 211 supports efficiency across our health and human services system. It strengthens a highly skilled workforce, improves access to existing programs, and helps ensure Minnesota's safety nets work as intended. Thank you for your time and thoughtful consideration.
Thank you very much for your testimony. Now, Mr. Knox, if you could state your name for the record and begin.
Thank you, Madam Chair and members of the committee. My name is Andrew Knox, and I am here representing Legal Aid. Legal Aid represents low-income Minnesotans, elderly Minnesotans, and Minnesotans with disabilities. I'm here to testify on the Minnesota Work Requirements, Article 3, Section 12. When the work requirements were passed in H.R. 1, these will have devastating impacts on legal aid clients, many of which are part of the expansion population. First, we would like to thank the chair for all the work that has been done to protect these individuals in the healthcare system so far. However, looking at the work requirement language, there are some specific issues that we would like to address. First, legal aid and other advocates have begun discussions with DHS about the exemptions, and we believe that there's more work to be done, especially around the definition of medically frail. H.R. 1 allows states to be flexible in crafting that definition, and it should meet the needs of our state. We feel that the definition should be consistent with other federal programs and include individuals that are already evaluated for their ability to work, such as those on general assistance. The bill, further, we also would like to see a more streamlined process in inserting these exemptions. The bill doesn't mention how to insert your exemptions, nor does it mention anything about self-attestment or to provide an audible self-declaration. We feel that a streamlined process is better for not only for these individuals, but for our systems. And we understand that CMS does not provide guidance, but we still feel that there's more work to be done, and we look forward to continuing to work with you on that work. Second, the Senate bill also doesn't include any due process language for enrollees who lose coverage due to not meeting the work requirements. It requires notice for noncompliance and a 10-day notice for termination, but it doesn't state anything about what needs to be in those notices, such as how to comply, how to assert your exemptions, or if you have rights to appeal. Third, we also feel that adequate support and funding for technology, DHS, counties, tribes, and navigators must be included in this bill. While some of these groups have been acknowledged, navigators are frequently left out of the conversation, even though navigators will be on the front line dealing with enrollees who need to apply, need to provide proof of exemptions, or deal with enrollees who have been kicked off of Medicaid for failure to meet these requirements. Finally, Legal Aid would encourage this committee to remove the language that denies eligibility for Minnesota Care if a person is non-compliant. We do not understand or feel this provision is even needed due to the lower income limit in Minnesota Care of $1,800 a month, which is 3 times as much as what you would need to be in compliance with the work requirements. However, what we are worried about is if the same issues happen to Minnesota that happened to Georgia when they implemented their work requirements, Minnesota might need to change our Minnesota Care policy in order to be a safety net for these individuals. And we hope that that door is not prematurely closed. Legal Aid looks forward to working with you as a partner. We have language. If you need any help, please reach out to us. If you have any questions, reach out to me. Thank you.
Thank you very much for your testimony. Next, I'd like to call forward Commissioner Barb Weckman and Commissioner Jenny Mongeau. And I apologize if I just said that incorrectly. Ms. Wackman-Brecky, please state your name for the record and you can begin.
Chair Wiklund, if you don't mind, I'll go first.
Okay, yeah, please go ahead.
Thank you. Chair Wiklund, members of the committee, my name is Jenny Mojo, and I am a county commissioner from Clay County, and I have been honored to serve in that capacity since 2015. I'm here to testify on behalf of the Association of Minnesota Counties, in which I serve as second vice president, and also the Minnesota Rural Counties. Thank you, Chair Wiklund and members of the committee, for your work and for your attention to two critical areas: the modernization of Minnesota's human service technology systems and the changes needed to implement federal Medicaid reimbursement without further straining our county systems. From a county perspective, both of these issues come down to one thing: whether or not our systems have the capacity to meet the moment. Modernization remains one of the most urgent challenges in which we face. Our residents are experiencing long wait times for essential service, and our staff are working in systems that are quite outdated. Although kids from the 1980s tend to be pretty awesome, technology from the 80s is not. These systems are outdated, inefficiency, and in many cases difficult to navigate. That creates frustration for the people we serve and real strain on the employees doing the work every day. It also requires a significant amount of time just to keep these systems running that are not designed for today's workload. That adds cost pressure at a time in which counties are already facing historic strain. We are concerned that upcoming federal changes could further stress our systems that are already operating at or beyond capacity. We appreciate the committee's inclusion of both immediate funding for system improvements and the creation of the Human Services System Steering Committee, both important steps towards building systems that are more functional, adaptable, and better aligned with the needs of our residents. I'd like to acknowledge that many of you have taken time to sit with county staff to see these systems firsthand, and you've seen the green screens, you've seen the workarounds. We appreciate that understanding. We're hopeful we can move from those challenges into real, lasting solutions. That same question of capacity carries directly into implementation of federal Medicaid changes. Counties have been working closely with the Department of Human Services to prepare to get this right. It's essential, not just for access to care, but for the stability of the broader system and to avoid increased uncompensated care when coverage is lost. We are encouraged to see several provisions in this bill that will support counties in that work. State support for outreach and education will be critical so participants understand changes and can maintain coverages. Using the Postal Service's National Change of Address database is a practical step that will help keep contact information current and reduce administrative burden. Support for external vendors to assist with new Medicaid work requirements will also be important as counties take on additional responsibilities. We appreciate efforts to align Minnesota statute with federal regulations, including targeted case management. This is a proven, person-centered approach that improves outcomes for residents. Finally, we value the recognition that counties must be part of ongoing conversations about system redesign, especially as changes to SSIS move forward. These systems will only work if they work in practice and on the ground. At the end of the day, counties are responsible for helping you turn your policy into real world service delivery. When systems are modern, functional, the families in which we serve will more quickly and effectively access services. When they're not, the strain is felt by both the staff and the people that rely on them. These investments are an important step towards strengthening the capacity so we can meet today's needs and prepare for what is ahead. Thank you for all of your leadership and for your continued commitment to Minnesota's human services system. I appreciate your time.
Thank you. And Commissioner, please state your name and begin your testimony.
Thank you, Madam Chair and members of the committee. Thank you for the opportunity to testify today. Thank you for allowing us to switch our order here. My name is Barb Wackman-Brecky, and I'm a Scott County Commissioner and the first Vice President of the Association for Minnesota Counties. I'm also here representing the Minnesota Inter-County Association, or MICA. I want to begin by thanking all of you for your work that has gone into this Health and Human Services Omnibus bill and for your continued partnership with counties. This legislation arrives at a critical moment, and it directly supports our shared commitment to strong, efficient, and accessible services to all Minnesotans. I want to express AMC's strong support for the provisions related to SNAP eligibility policy changes and thank Senator Bolden for her leadership in this area. Counties are implementing historic federal changes that significantly increase workload and require extensive new processes and reviews. This bill's approach, maintaining the county's share of SNAP administrative costs at 50% and assigning responsibility for program error rate benefit payments to the state, is essential. If Minnesota does not act now, counties would face an automatic cost shift to 75% under federal rules for SNAP administration, while also millions for a portion of SNAP benefits, a federal program. This would be unprecedented, unsustainable, and would immediately strain local property taxes. This bill prevents that outcome. It ensures that counties can implement and administer SNAP effectively without damaging impacts to other essential areas of local government. We cannot miss this moment. The stakes for the communities and people we serve, for counties, and for frankly all property tax payers in Minnesota are simply too high. Second, I want to thank you and Senator Champion for the provisions addressing the Minnesota African American Family Preservation and Child Welfare Disproportionality Act. Counties really do support the intent of this work and the urgency behind reducing the disproportionality in Minnesota's child protection system. But to succeed, counties need the right structure and resources. AMC strongly support the bill's direction, placing case reviews and oversight at the state level. This work is complex and must be adequately resourced to ensure statewide consistency, quality, and equity, and help us meet the outcomes that we are really trying to achieve. And I want to be direct. Substantial investment is not optional, it's essential. Without dedicated funding, counties would face an unfunded mandate of a scale that would force difficult trade-offs in other local services, as well as increases in property taxes. With appropriate resources, counties can partner with the state to do this work well, with fidelity, and deliver the high-quality programming that our most vulnerable children need and deserve. We are grateful for the investment included in the proposal and look forward to working with lawmakers to ensure that the resources fully match the scope of this transformative effort. And then finally, I just want to emphasize the broader theme of modernization and shared responsibility. County systems, state systems, and federal policy changes intersect in ways that directly affect Minnesotans and Minnesota families. When responsibilities shift, as they really are this year, the funding, the technology, and the workforce supports must shift with them. This bill recognizes that reality, and counties deeply appreciate it. Please continue to reach out to us for data, information, and discussion about how these decisions directly impact the people we serve, the workforce who delivers these services, and ultimately the taxpayers of Minnesota. Thank you for your time and your work.
Thank you very much for both of you for your testimony. Next, I'd like to call up Peter Wojtak and Sophie Wallerstedt. Welcome, and if you can please state your name for the record and begin your testimony.
Thank you, Madam Chair and members of the committee. Peter White, Government Relations Manager with the Food Group, and we are grateful that the committee has recognized the urgent need in this bill for prioritizing hunger relief, including additional funding for both the Minnesota Food Shelf Program and the Regional Food Bank grants. Your support comes at a time when demand for food assistance is at historic highs, and we appreciate that this remains a priority for this committee. At the same time, this represents roughly a 25% reduction from the funding levels food shelves have relied on in recent years, resources that have been essential to helping food shelves keep up with record demand, driving rising grocery prices, reductions by key nutrition programs, and the broader affordability crisis that many are facing across the state. And food shelves and food banks are doing everything they can, but they're stretched to their limits. And we know with the federal SNAP changes and cuts, reduced benefits for households already struggling to afford groceries, food shelves are expected to absorb even more of that need. So we deeply appreciate the investment included in this bill and the committee's commitment to addressing hunger, and also want to emphasize that more support is needed to fully stabilize the emergency food system during this challenging time. Thank you so much.
Thank you very much. Ms. Wallerstedt?
Thank you, Chair Wiklund and members of the committee. My name is Sophie Wallerstedt. I'm the Public Affairs Manager for Second Harvest Heartland. We are a food bank serving more than 1,000 food shelves and food distribution programs across 41 Minnesota counties. I'm here to thank you for your proposed investments in the hunger relief system and stress the need for additional state support following 4 consecutive record-breaking years for hunger in our state. Minnesota's hunger relief network is strong and resilient, but we have experienced extraordinary growth and demand over the past 5 years, and we do not expect these numbers to decrease anytime soon. I think we've all personally experienced the rise in grocery prices over the last several years, and I looked last night, according to the Federal Reserve, the price of food has increased by 30% since 2019. Families feel this in the checkout line, and our food banks and our food shelves feel this when trying to source enough food for our neighbors in need. Today, already 1 in 5 Minnesota households cannot afford the groceries they need for themselves and their families. And looking ahead, the USDA now expects food prices to outpace inflation this year, while the incoming SNAP cuts will mean that more Minnesotans will have to get by with less. I do want to be clear, we have appreciated the one-time funding you've been able to provide the hunger relief system the last 2 years, and we are concerned that the reduced amount proposed this year will be unsustainable for our network in this truly unprecedented time. We are deeply concerned that more Minnesotans will go hungry as food shelves are forced to scale back hours, reduce the amount of food available, limit visits, or close altogether. And I think you already know this is already happening in Minnesota. We've seen strong bipartisan support for food banks and food shelves this session. Our original ask of $15.4 million for food banks and shelves is a drop in the bucket in the grand scheme of things, but it would make an enormous impact for our neighbors across the state. We respectfully urge you to continue to push leadership in both parties to deliver for our neighbors experiencing hunger this session. And again, I want to thank this committee for acknowledging that fighting hunger in our communities is worthy of state investment and that everyone deserves to eat. Thank you.
Thank you very much. And that concludes our testimony on the bill. Members, I know that we were just talking about having time for discussion, but as our practice has been over the past 3 years is that we have a day that we take testimony, and then we have a day for the member discussion and markup. So tomorrow is the day that we are going to have member discussion and markup of the bill. You can bring forward amendments and your discussion. I do want to ensure we have enough time for me to briefly go through the informational presentation of the draft proposal relating to hospital stabilization. I know I said earlier that there would be time for discussion today, but we do have 5 testifiers regarding the hospital stabilization proposal, and I want to make sure we get through all of those. So
Madam Chair,
Senator Abler.
respecting your request, could I just put in my order, for instance, information from the people on the child care thing, and then they can get it to me offline. That'll save you some time. So I asked
Senator
before
Abler.
just about what current law is on the preschool assessment, which is 66.5. What's the current law on immunization records on 148.1? What's the current law on annual well testing, which is on 172.10? And what is the current law? What's the current law on this firearms reporting? So, thank you.
And just to clarify, the firearms reporting, are you talking about the child care article, or are you talking about?
181.3 of the.
Is that an
licensed
article?
homes.
Okay.
That's mine. So if you have enough numbers, there's 2 firearms, 147.16 and 181.3. So
Right. I just wanted to make sure because I don't have the pages memorized yet.
Well, no, that's fine. Thank you, Madam Chair. I do appreciate that.
And I hope that several of those items I think are agency proposals, and so I want to make sure that they know that you're asking for information about them.
Well, Madam Chair, I'm trying to help you successfully get some of these changes across the line. Some of these are actually probably fatal flaws, which will make them simply not happen. And so if we can find a way to know what the current law is, and we can help people understand that, and then realize that maybe the agency has to let go of some of these things that they would like to actually get the bulk of the work through. That's my goal.
I understand.
Is to help you get this 95% across the finish line. Thank you.
Thank you. So we will move then to, I will give a brief overview of the informational draft proposal that we have before us, and that was posted just yesterday. And this is a bill draft that is meant to address what we have been discussing this session as a need for assisting our hospitals in our state. There's a need for direct support, I believe, for Hennepin County Medical Center. And we have been discussing multiple options about ways to do that. This proposal is being brought forward because I believe that while it is important to discuss multiple options, and passing a tax provision is one of those, I think passing a tax provision is an uncertain prospect this session. And I believe that we need to be discussing what a direct grant of sufficient size, what that would look like to provide to Hennepin County in order to stabilize the hospital. There's also need, we've discussed, for financial support for a number of the other hospitals in the state. And this bill would provide a way for direct grants to be provided to hospitals that meet specific criteria that we determine indicates financial distress. Also included, because of the need that was discussed and demonstrated last week when I presented my other bill, Senate File 5047, we have included stabilization programs for the federally qualified health centers, certified community behavioral health centers, and EMS programs. In looking at ways to support Hennepin County as well as other hospitals, I believe there needs to be accountability and reporting measures included, because we want to ensure that we understand how the money is being used. This is a significant investment that the state is making, and that we communicate some important goals for use of the funds. And for Hennepin County, we've included specific reporting requirements, and also accountability for use of the funds. They need to provide quarterly reports and also tell us more about their strategic plan for long-term fiscal sustainability. We also have some reporting requirements that the Department of Health Commissioner will bring forward regarding financial stabilization of the hospital and recommendations to improve stabilization, and also reporting on financial stabilization of hospitals statewide. We also have a role for the legislative auditor to review and confirm whether Hennepin County has met the requirements of the section in the bill, and if they have adhered to the strategic plan for long-term fiscal sustainability that needs to be provided. And in reference to governance, we do have language that requires Hennepin County to develop a plan to move forward and away from the Hennepin County Board of Commissioners acting as the corporate board. In terms of other hospitals, we do have reporting requirements and some accountability for use of the funds in that section as well. And for us as legislators and for the state to have a better understanding of the financial stability of hospitals, there's direction in the first section of the bill to create a report that would be submitted with each November forecast. This would give the administration and policymakers the ability to understand current circumstances of hospitals, including whether any hospitals are determined to be financially distressed. While this proposal does not include ongoing source of funding, it is set up to be one that could be funded beyond the appropriations that I'm bringing forward in my omnibus today. It's not to suggest that ongoing funding isn't needed. I think it will be. But the work of this session must focus on addressing the emergencies we are facing today. And I realize there are limitations on how the legislature could choose to act. I'm definitely open to discussing changes to the bill language. We have proposed criteria for hospitals to meet to be included in the stabilization program, but that is definitely something that I need to work with. If members have suggestions, or working with the Hospital Association and with the Department of Health on that aspect. So that's one example of areas that we need to continue to work on definitions and criteria. Members, in the bill, I believe the spreadsheet indicated what we were proposing for funding for these different programs. For Hennepin County, the grant would be $150 million in this biennium. For the Provider Stabilization Grant Program, which would be the hospitals, that would be at the level of $114 million. And the community-based safety net provider grants was at $17.6 million. And then the EMS proposal is set right in this bill at $15 million one time. So that is a very high-level overview of this bill proposal, and I know we will continue to have more discussion. We will formalize this into an amendment that I will bring forward tomorrow for our markup discussion as well. Senator Abler.
Briefly, I just want to thank you for working on this. I think you're on the right track. There's a lot of room, and it's nice that the Senate can show some leadership. And, you know, I have my ideas, but we just need to move forward. I think the sales tax idea is just going nowhere. So thank you for doing that.
Thank you, Senator. Next, I'd like to go through the testifiers, and then if there is other time, you can ask some more questions. First, I'd like to call up Michelle Benson and Rochelle Westland and Jinlee Palin. Welcome to the committee, and Ms. Benson, if you can state your name for the record and begin.
Thank you, Madam Chair. Michelle Benson with the Minnesota Hospital Association. I thank you for the opportunity to testify today on behalf of the Minnesota Hospital Association, our 139 member hospitals and health systems. Just a short time ago, we appeared before you to highlight the urgent need for an uncompensated care pool to support providers who care for every patient, regardless of ability to pay. We greatly appreciate Senator Wiklund for introducing this budget proposal. As my predecessor, Mary Krinke, would often say, more money is better than less money. So, Madam Chair, as you go forward, I'd like to keep that in mind. Section 1 of the bill establishes an important annual report on the financial stability of Minnesota's hospitals. This report will help elevate the serious financial challenges facing our hospitals and better equip future legislators as they balance the responsibilities of maintaining access to care and managing tight state budgets. We are already developing a detailed list of recommendations to strengthen the report, such as shifting the deadline to the February forecast so the most recent data can be used. We look forward to working with Senator Wiklund and the committee to deliver constructive, forward-looking metrics that give future legislators accurate and actionable information. In sections 2, subdivisions 1 through 5, a flexible framework similar to Senate File 4252 allows the proposal to evolve as we move forward through the budget process. The Minnesota Hospital Association again stands ready to provide technical assistance to Senator Wiklund as this language is refined. In particular, we believe we can help strengthen the eligibility criteria so hospitals with the most limited capacity to absorb uncompensated care receive the support they need without having a list of excluded entities. Subdivisions 6 through 8 raise some timing and reporting concerns. Our shared goal is to ensure that these limited funds are used to preserve and protect patient access. We look forward to collaborating with Senator Wiklund to meet her objectives while minimizing any additional administrative workload on Minnesota hospitals. MHA and our members are deeply grateful for the lifeline this bill represents. We thank the committee for extending support to our partners in community-based safety net services and rural EMS. Finally, we appreciate the recognition that a short-term stabilization solution for HCMC is necessary. This committee understands that Minnesota hospitals and partner organizations slated to receive this funding share a common mission to be there for every patient, regardless of ability to pay. We are partners in care, and we are partners in this request. This targeted relief directly addresses hospital burdens and keeps our hospitals financially stable, continuing to deliver 24/7, 365 access to high-quality care. Senator Wiklund, we want to especially thank you for your partnership and steadfast commitment. As I pause just a moment, the report will help transfer knowledge that you have developed to future legislators and put it in a place that's easy for them to find and take in, so that for the benefit of people who will remain on this committee and join this committee in the future, some of your knowledge will be transferred. And I want to thank you for thoughtfully moving forward into your retirement as you face your last committee hearing. So we stand ready to answer any questions and to help in any way to make this very efficient process as we move forward. Thank you.
Thank you very much. Next, would Rochelle Westland, if you could please state your name for the record and begin.
Thank you. Good morning, Madam Chair and members of the committee. My name is Rochelle Westland, and I am here representing Minnesota's FQHCs with the Minnesota Association of Community Health Centers. MINAC represents our 17 federally qualified health centers who provide primary medical, dental, and behavioral health care in medically underserved areas. Thank you for the opportunity to speak today and for the support that you've given us last year and this year as we work to serve those who may not be able to access care in traditional settings. Uncompensated care places immediate pressures on clinics, staffing, and services in a time where we see demand continuing to increase. This funding would provide additional support to help ensure that every Minnesotan continues to have timely access to these essential primary care services. Primary care is often one of the most effective and evidence-based strategies for reducing overall health care costs while improving patient outcomes. By providing timely preventative services, primary care providers help patients avoid costly emergency room visits and hospitalizations. What is so great about this bill is it really does address the safety net as a whole with our partners with the CCBHCs, EMS, and the hospitals. FQHC is serving just a part of that healthcare safety net for that primary care. Last year alone, FQHC saw over 585,000 visits to low-income patients across the state of Minnesota. 31% of patients were uninsured and 44% relied on Medicaid. So we see this really disproportionate amount of low-income patients. And we know it's really important to provide that community care. We've always operated on really limited budgets, so as health centers face these similar pressures of rising uncompensated care and increasing financial strain, many of our clinics don't have a cushion to fall back on, many of them operating in the red or with limited days cash on hand. We're deeply concerned that the continuing increase in the number of uninsured patients will stretch many of the FQHCs beyond their capacity. Currently, we're providing about $46 million in uncompensated care, and this is once we already include the funding that comes from our federal 330 grant and our current state subsidy. So we really appreciate the investment that you're willing to make sure that those who need it most can be served across the state. Thank you so much for the opportunity to speak today, and I am here for any questions.
Thank you. And Ms. Palin.
Thank you, Madam Chair and Committee. My name is Jinley Palin. I'm with the Minnesota Association of Community Mental Health Programs. Thank you for this opportunity to testify, and thank you so much for all of your support of this issue. And our community-based providers, our ambulance providers, and our hospitals. On behalf of the Minnesota Association of Community Mental Health Programs, we want to offer our strong support and encourage the continued good work that we have been doing to support our state safety net. Our association represents the community mental health centers across the state, as well as our certified community behavioral health clinics. As essential community providers, we are the mental health providers who never deny care based on insurance status, the ability to pay for care, or where an individual lives. In many regions of the state and in many circumstances, we are the only outpatient access to mental health services for many clients that we see. With the anticipated implementation of HR 1 provisions, we are anticipating drastic numbers of individuals to be denied or disenrolled from their Medicaid coverage. Our state's community mental health care system is fragile and facing a crisis. The progress and intentional investments you and the rest of the legislature have made into our mental health system over the last decade will be eroded with these new federal changes. The Community Mental Health Center model was designed to provide critical outpatient and community-based care when the state decided to close its mental institutions and hospitals. The Certified Community Behavioral Health Clinic model was developed to bring new comprehensive services to sustain community-based care across our nation. Both these models are mandated to serve everyone regardless of their ability to pay. We never deny care. Both models also have enjoyed very strong bipartisan support, both here at the state level as well as at the federal level, and yet their core funding mechanisms will fall under Medicaid changes in HR 1. The individuals, the families, and the communities that we serve will not go away with these changes, but their access to the care they need will be greatly diminished if we do not make any changes. And this is why we are so grateful for the work of this committee and Madam Chair to you for providing this very strong bridge support to assist with the increased uncompensated care that our community mental health safety net will be experiencing, along with our community health center friends, hospitals, and the emergency medical services folks. So thank you so much, and we encourage support of this provision.
Thank you very much. Next, I'd like to call up Julia Covert and Ben Baggio. And I don't see Ms. Covert. Mr. Baggio, if you can state your name for the record and proceed.
Good morning, Madam Chair and committee members. My name is Ben Baggio. Thank you for allowing me to testify today on behalf of the Minnesota Nurses Association, the union representing over 22,000 nurses that work at the bedside across our state, including 1,500 nurses that call HCMC their workplace. I'm testifying today in support of this proposal by Chair Wiklund, first and foremost because it's been pretty tough sledding around here trying to get people to talk, at least openly or publicly or substantively, about long-term funding solutions for HCMC. And while I know other proposals are still in play, I'm grateful that everyone on this committee seems to already understand how important it is to keep the doors open at HCMC, and also grateful that you are all wisely weighing other ways to ensure HCMC remains open, such as this, and that's why we support this proposal. I would not be doing my job, though, if I didn't take the opportunity here to make sure that it's on the record in this committee that HCMC needs long-term funding past this session in order to avoid a potential workforce crisis. I hope you all realize that HCMC nurses make less than their private sector counterparts, and that they do this because they love the hospital's true safety net mission. But everyone has their breaking point, and no one wants job uncertainty or to be tied to a sinking ship. The only way to give workers the legitimate reassurance they need and deserve, and to make sure recruitment and retention don't suffer beyond repair, and that patient care does not also suffer in return, is to make sure that long-term funding for HCMC also passes this session. Next, I would just like to ask you that as this progresses, you will consider even more explicit guardrails to ensure that the money flows where it's needed truly the most. Our state's healthcare regulatory framework often treats hospitals as independent one-off entities, but as we've heard elsewhere today, it's not the 1980s anymore, and that's not actually who owns and operates the vast majority of hospitals in Minnesota. The status quo here at the state level does not do a very good job of tracking the flow of money across the largest health systems, the same health systems that often own both very profitable hospitals and also hospitals that could be deemed to be financially distressed. While they also often own or control other for-profit or nonprofit subsidiaries that don't even fall under the regulatory purview of MDH. This is a national issue, but I also think there's a major opportunity for Minnesota to right the ship, and maybe that path can be baked right into this proposal. Thank you, Chair Wiklund, for all your work to safeguard Minnesota's hospitals this session, especially in light of the fact that our already crumbling healthcare system is now about to have the rug pulled out from underneath it this summer. Whatever happens this session, I hope that you, this committee, and others here in the Senate will prioritize and also pass long-term sustainable funding for HCMC, and that you guys continue to bring nurses to the table as you weigh these consequential decisions. Chair Wiklund, thank you again for your leadership, and thank you, committee.
Thank you very much. Members, do you have any questions or comments about this draft proposal? Okay. I guess you can go. Senator Abler.
First shall be last or something. No, I just wanted to commend you, Senator, and actually I think they're the realists that testify about trying to get this going. Appreciate all the voices that were here, and I think one thing we haven't spent much time talking about is this governance thing. I brought it up when I commented, but it's just to continue, and I'm glad you put it in your bill that there has to be some changes, and certainly the county board will continue to oversee it, but if I were king, and Madam Chair, I am not king, did you know that? I would put 2 county board members on, I'd put 1 or 2 nurses, make sure that they're, ASME and SEIU are represented to the extent that they're part of this, doctor from the place, but also some people actually know the business. So there's kind of buy-in, and the team effort that is there on a good day can continue. And I think that'll be successful. And I think, I noticed that it's not in your budget sheets there, but I think this is something that we really have to go to the till for. And I guess the cost of your thing is in the range of 300 or so, and I think that's what it's going to take. And I think that it's well on its way, and happy to be a participant in that if you need any help. And but it's at least it's a real thing that actually that actually could pass. It could get support probably from 70% of the legislature, I would think, compared to the sales tax idea. So thank you, Madam Chair.
Oh, you're welcome. Any other questions or comments today? Okay, well, I hope members will continue to think about, how would you recommend improving? But I do think, as Senator Abler said, I think we do need to take action this session, and I want to make sure that we have proposals available that can gain support, and we can provide a way to at least make a difference for these entities in this session. So thank you, and we have reached the end of our agenda, and this meeting is adjourned.